In this video, I interview Isabel Mellier. Have a listen and see if there's anything you can learn from or be encouraged by as you listen to her story as she embarked on her quest to learn primary care dermoscopy. Training a primary care dermoscopist for every general practice. Welcome, Isabel.
Thank you for having me.
Thank you for coming in. What do you think of the set?
Very impressive.
Flowers just for you, just
like
to
it.
smart things up. Okay. First of all, though, would you like a Jaffa cake?
I would love a Jaffa cake.
You have a
Thank
Jaffa cake. You're a Jaffa cake lover.
I am.
Excellent. Good choice. Thanks for coming in, because I thought it would be really useful for my viewers just to listen to someone who's a bit closer to the beginning of their dermoscopic career than I am.
Yep.
Does that make sense? So in other words, when you first start dermoscopy, you have a lot of questions, a lot of things that you have to wrestle with. And it's been a while since I've done that. And you've been through that more recently.
Indeed.
So I'm hoping we can tease out of you some little tips, some things that the people watching might think, oh, okay, that makes sense. Mm-hmm. And we'll just help them forward on their journey.
Yep.
Does that sound all right?
Absolutely.
Can I just confirm that I don't know what you're going to say?
No, you do not.
So we've talked a little bit about the questions, haven't we?
Yep.
The areas we might cover, but we haven't kind of like done any.
No, you don't know what I'm going to say.
Okay, right, fair enough then. So anything she says is not my fault, folks. So first of all, just say a little bit who you are.
So my name is Isabel Mellier, or Izzy, and I'm a physician associate and have been qualified since November of 2020. So that's just over 3 years. And I started with dermoscopy probably about 18 months ago, but I had an interest probably about 6 months earlier than that, I think, I would say. And it has steadily gone upwards. Okay,
well, that's good. Not downwards.
Nope, that's always a good thing.
Okay, 18 months. Okay, okay. So why did you have a little bit of an interest? Had you heard about dermoscopy then before?
I'd heard a bit about dermoscopy. It's something that's used in general practice. You use it, and other GPs have a dermoscope. But it was not something I considered going and using until I started speaking to you more, and I think it's very beneficial, which I'll talk about later, in having in general practice.
Right.
So that's when I started to get more interested, and having it as another skill is very useful.
Yeah. So no one came along and said, here's a course, you know what you do, anything like that?
No.
But you'd seen it around and you thought, oh, that looks like fun, I might enjoy that.
Yeah, absolutely.
Okay.
Yeah,
right.
Because it is fun.
Okay. So where did you go from there then? So you'd seen it around a little bit, you see maybe other people using it a little bit, and now you're 18 months into your dermoscopic career. Mm-hmm. Just looking back over the 18 months, what's that journey been like?
As I said earlier, it's been an uphill.
Okay.
Not always straight up. There are some dips, but that can happen in any learning process, I think.
Yes.
So I think I came to you with an interest in it.
Right.
And
how did it all start? Because I work with Isabel, although we do different days. So it's nice to catch up with you, actually, isn't it? And we did run a spot clinic together for a while, didn't we? Which is quite key.
Yes.
But, just to see how that kind of like, how did it all start? Did you come to me or did I come to you?
I think I came to you with an interest in skin and wanted to learn more about it, and I think you were also willing to teach. So I think we were both eager in that
I was
sense.
wanting to teach, you were ready to learn.
Yes.
That works well then, doesn't it?
Yeah, it did.
Okay, you didn't have to twist my arm or anything.
No, and you'd have to twist mine.
Okay, fine. So, and just in terms of how you've learned, in other words, there are different ways of learning dermoscopy, aren't there? Mm-hmm. You can go to books, you can go to the internet, hopefully you are, folks. You can go on courses, expensive courses, or you can just sit there and someone teach you.
Yep.
How's your mix of learning be?
I think for me, I am quite a visual learner and also get going. So that's something I found beneficial, is working alongside you and being able to get straight in there, which I'll talk about a bit more later. Okay. But getting straight into it once I had my dermoscope, I've got both of the ones I've used here. Starting to use that, building up a knowledge by seeing patients I found most useful, but I also read around, I did watch some videos and used online links because I found that beneficial, but the best thing was getting stuck in and then...
So your patients are your best teachers.
Very true. I didn't even know that sort of...
Didn't you?
No.
I missed the R. Yeah. So your patients are the best teachers. Isn't that cool?
Yeah.
And I always have that on screen. People might have noticed. Because I think that's very true.
Yeah.
Because you can read books, you can do all these things, but until you start looking at patients and dermoscopes, you go, what's that?
Yep.
It's a different kettle of fish, isn't it?
Definitely.
Okay, great. That's great. So, so kind of like you kind of like joined me, didn't you, in my weekly spot clinic? And you would run your own little clinic next side to me, and we will discuss cases and do that, well, a few bits and pieces. How did you feel in those early days? Was it kind of like, whoa, this whole world had opened up to you, you know, or how did it feel just as you start putting that dermoscope on to start with?
I think I had a bit of a basic understanding because you had taught me things. We'd had discussions about what's common is common, so I knew the things to look out for, but it is a wide world, and things that you see online don't always appear exactly how you see them on patients. No. So you do have to build up a portfolio of in your head about what things and what everything looks like. So whilst we'd had discussions and I'd seen things with you, seeing them on actual patients was just so different. So it was just starting slowly and then building up to, and then the world kind of became smaller and then became bigger again as my knowledge improved and I got better at the basics to try and work on the things that were not so basic, I think.
So it's that learning curve, isn't it?
Yeah.
You know, it's, you know, that initial getting over the hump, getting the whole base of, actually there's a range here, and feel confident that that's not a cancer, it's a SEBK, I don't need to refer.
Yeah.
And you're, so in one of my videos I'm going to be talking about the dermoscopy paradox. That's when you first start dermoscopy, the fact that rather than just referring everything to Telederm or someone else, that what you do is you take on that responsibility yourself to try and diagnose it. So your anxiety levels go up initially.
Yes.
I mean, so how did you manage those, you know, initial, I don't know what that is?
I think the same way that you manage a lot of your other patients. Sometimes you don't know what things are and you have to obviously safety net and then also ask for feedback from other people. If you don't 100% know what it is, you have got people that you can ask. We talk on Pando and it's very good within talking to other clinicians. But then having those photos which we can attach to the medical records, I can say, oh, I'm not sure. But at the start, you're always going to be anxious. And again, when you start something new, you are going to be nervous about it, but you have to kind of push yourself into it, I think.
Yeah, and I think one of the things I think I want to get over to people is when they start dermoscopy, think about that process. You're going to have that anxiety. And, you know, how can you have someone walk side with you? You might not have someone in your practice who can do that for you. But maybe you can join a Pando group, like a WhatsApp group where you can share images and say, hey, is this okay or not, to give you that reassurance.
And we don't always work together, and I'm at a different GP practice sometimes, so it is really useful having that group if I need it and like, actually I'm not sure what this is, can I have some help? And sometimes with my other GP practice you have to use teledermatology. There's nothing wrong with that. It is just building up your knowledge. So let's say a lot of people just send off everything there. I'd probably send off 1 in 100 now. Like it's that 1%. You're getting from 100% because you're not even bothering to learn it to that smaller bit.
Yes, I mean one of my videos is about Telederm being crack cocaine. You know, because it could be very addictive because you don't have to learn, it reduces your anxiety. At the end of the video though, I do mention the fact it has one positive thing. And if you send it, the important thing is that you look for the result and you find out, so you learn and build up.
You get feedback from them, which is useful.
Just out of interest, do you use any particular algorithm or is it an internal algorithm? In other words, you look at that and think, I know what that is, I'm happy. How does it work with you? I
think when I started, it was, am I happy? Yes, no. And then if it's yes, brilliant. If it's not, then, oh, I'm going to go and ask someone. But now it's kind of, well, why am I not happy about this? And that's the knowledge that I've built up over the last, let's say, year or so. But at the start, I would definitely come to you or someone else for more advice, less so now. But also just following all the knowledge that I've learned again throughout the last 18 months or so.
I've noticed you don't ask for my help so much. Is that we just don't talk anymore? Is it all that you've got the confidence now?
Yeah, and I think I have got the confidence again with seeing things. And it's a lot of those ones I am sending to you are those more difficult ones. Again, I've got through the seborrheic keratoses, the cherry angiomas. I understand them. They don't worry me anymore. It's those actinic keratosis that may or may not be. It's
Yes.
those ones that you're not 100% sure about,
Yeah, yeah.
which I think is still fine. You always ask friends for advice, so why would you not ask a colleague?
You would, and I think there is always going to be that grey area. You know,
Yeah.
when you talk to the consultants in hospital, you see the international gurus of dermoscopy, they still have a grey area and they're still learning. And I think that's one of the great things about dermoscopy, you keep learning. So do you think dermoscopy is for life, not just for Christmas for
Yes,
you?
definitely.
Okay. So it's definitely one of your skills. You think you see something and you reach for your dermoscope.
Yes, and it is a really beneficial skill to have in general practice, and a lot of my patients love it. It's a nice little gadget. They're like, oh, that's very fancy. And I say, yes, it is
Okay.
fancy. Thank you very much. I know how to use it too, which is
Really?
useful. Yeah.
So, yeah, I'm interested on how other people respond to it, you know, because it is still a relative novelty, isn't it,
Yes.
in primary care? And you know, I have patients who, it's like taking out a dermoscope. You feel like a proper doctor sometimes,
Yes.
don't you? You pull out your dermoscope and it's like science and magic, isn't it? Don't you think?
Mine is attached to my phone, so we will go through that. So I have to make sure I tell people I'm not texting anyone whilst this, but I have this amazing little gadget, and everyone's like, "Ooh, that's fancy," and I'm like, "I know, thank you," and it's good for taking photos.
So, but I'm also interested in knowing how your colleagues, you know, perceive, you know, and think about you and dermoscopy. Any comments from colleagues?
I think as a physician associate, it's a very good skill to have, but it's not something that just GPs can have. But I think now I am known as someone that enjoys skin.
Okay.
And it's not because I have a dermoscopy, I want to make this very clear, it's because I enjoy seeing it.
Right.
And then that is at both the GP practices I work at. Everyone knows I enjoy skin. Yes, I have a dermoscope and it has consolidated my learning, but it makes it more enjoyable when I see someone and I can know what the answer is. Everyone likes getting the right answer, don't they? So having the dermoscope is just a bit of a cheat sometimes.
Yeah, and you've got that reassurance, haven't you, as
Yeah.
well? You know, you think, oh, I think that's a Seb K. You look at it, yes, it definitely is a Seb K for A, B, C, D reasons.
Yeah.
And also the fact that you can much more easily put it in the notes. So we're going to do another video on how to put things in the notes, because I think that's one of the most
Yes.
very important skills to have.
Yes.
If you have a dermoscope, you can take a picture. You're actually halfway there, aren't you? Because then if you do a telederm referral or to your colleagues, you know, I'm so frustrated with colleagues who sometimes say, Andy, can you see this patient? Yeah, where's the photograph? Oh, you haven't taken a photograph. You know, then why bring them in for an appointment? Because half the time I can look at a photo and I know what it is.
Yep.
Does that make sense?
Yeah.
So you think photography, that people need to learn how to take photographs?
Absolutely.
So how do you do it? Like, let's look at your first dermoscope then.
Yep.
So this is what, your HUD?
Yes, so started out with this one. So this attached to my phone very nicely. So it's just a nice little phone case. And then this is a USB, which I found very useful. And just goes straight in, and then I can immediately take photos.
And it's
like
awesome,
that.
isn't it? Yeah. You can't get hold of the HUD ones now, or Hoot, because they're Swedish, Hoot ones, but there's a Hoot 2 now.
Okay.
So
Still very useful. That's what I started my career with, and I really enjoyed it. And I think
Yeah.
it was still beneficial for me. But now I've moved on to.
And this is a polarised. So this is a
Yes.
polarised, no gel needed, but it's got no faceplate, which is one of the downsides with the Hoot ones.
Then I've got this one now.
So which one have you got now?
This is the Derm Light.
Derm Light.
So it's DL1.
DL1. Okay.
Yeah. So again, it's just a small attachment onto my phone.
And how long does that take you to put on your phone?
Normally at the start of the clinic, I will just have this straight on.
Okay.
And then this is generally either charging, because obviously it needs charge.
Yeah.
And then all I do, and
And you're away. Because things have to be quick, don't they?
Yeah.
You know, in general practice, I don't think we've got the time to spend a minute finding a dermoscope, putting it on. Because if you haven't got it in your bag and it's ready to use, I don't think you're going to use it, are you?
Yeah.
So do you carry it around with you at all in your bag and stuff
Yes.
like that? Okay.
Yeah, it's in my bag because I move between two different GP practices. So
Yeah.
it would be silly if I just left it at one and then didn't use it for the other 2 days. As again,
Right.
it's something that I want to keep up. And for me, it's as beneficial as, let's say, it's not as useful as an O2 SATS monitor, but I keep it in the same bag and it's with everything and it's on my desk, as with my thermometer and my O2 SATS monitor.
Yeah. Because you help one of our doctors at the nursing home, don't you?
Yep.
And obviously, a high elderly population, you can have all sorts of sun-damaged skin and all sorts of things. And you picked up. I had a colleague who texted me and messaged me, said, Andy, Isabel has picked up 3 cancers.
Yeah.
So you know what's been happening.
Well, you go in for a lot of reasons in these care homes, and you go to listen to someone's chest, they don't have their t-shirt on, and you're like, ooh, that doesn't look very good.
Okay.
And it's one of those where I was just having a listen to his chest, and I was like, does anyone know about this? And the staff were like, oh no, I've never seen that at all.
Was that the melanoma one?
That was the melanoma.
So I'm going to show them the picture of that because you've sent it to me.
Yes.
So, okay, and I love that, and that's the great thing, because as soon as you start to get into dermoscopy, I've actually been walking around shopping in Tesco's or somewhere and said, actually, madam, can I just have a little look at that? How long have you had it for? Do you know what I mean? Is it wobble positive? Is it an intradermal nevus or BCC?
Yeah.
Just because your eyes are now attracted to the skin, aren't they?
Yeah, so much so. You can't not look at it, but that's a good thing. Like this was a gentleman with a melanoma, and yes, when you see it macroscopically, you hopefully would be worried about it, but having the dermoscope there and seeing what it on is, I taught the colleague that you're talking about and the carers, like, do you want to see this photo? How interesting is this? Yeah. And they were like, again, that's amazing.
It is.
Look at all our others. So they were like, can you look at that? Can you look at that? And I did, and then found, unfortunately.
The one you saw, you can remember the picture, can't you?
Yeah.
So I've showed it to people. What was it then about that will tell you it's a melanoma from that picture? Can you remember it?
It was very dark. It was very irregular borders. Okay. It was asymmetrical.
Yes.
And again, having that dermoscopy, it was quite big. I think it was over 20 millimeters.
Yeah. Can you remember on histology what it was? Intradermal? Was it in situ, or do you know what the basal thickness was?
They said it was an invasive melanoma.
It was an invasive one. Okay,
yeah, it was an invasive melanoma.
So it probably would have caused him trouble at some stage.
Yes, definitely. Then. And just because they're in a care home doesn't mean we're not going to treat them for it.
Absolutely, that's right. And the thing is, the earlier they are, smaller they are, better the prognosis, the smaller the scar, and all things like that. How does that make you feel?
Really good. And again, it's nice that you can just, like, yes, it was a melanoma, and I think hopefully people will pick that up, but the fact that we were able to pick it up so quickly and everyone is so grateful for that, the carers, the GPs I work with, and the family you have to think about as well. They are very grateful for that. Okay. And I think dermoscopy helped. Again, the people that I'm sending that referral to, they know to be worried, and they know they've got a dermoscopic. I don't even know how quickly they were like, yeah, we definitely need to remove that. Right. I don't know if that quickens that process for them because I sent the dermoscopic images.
I think they've probably seen it anyway, but it increases, again, their confidence. Yeah. And they'll know how to prioritise it. Say, that's a priority, bring them in next week, not 2 or 3 weeks sort of thing. And that all makes a difference, doesn't it?
Yeah, I agree.
Okay. That's really cool, isn't it?
I think so.
It's cool when you pick up melanomas no one else has.
Yes.
Do you know what I mean?
But it's not just melanomas, it's also those other BCCs as well, and the things that people would just leave, or they're like, oh, it's not really bothering you. And then you're the one concerned about it, aren't you? You're like, can I just have a look at that? Yeah. And then you're like, actually, I think that needs to go somewhere. Yeah, and I think that's a good skill to have. Yeah. Because they're the shade.
In truth, we don't see a lot of melanomas, do we?
No.
I mean, how many melanomas have you picked up in your 18 months?
3.
3, okay. I'm at about 12 or something like that. So it is about 1 to 2 a year, isn't it? Something like that. How many BCCs have you picked up?
A lot more.
Yeah, absolutely.
A lot more.
You know, so they're more common, aren't they?
Yes.
And, you know, intradermal nevus, there are other lumps and bumps. To be able to then pick that out, BCC out, is really useful, isn't it?
Yeah. Okay. And they don't all look the same as well. And that is the skill that you have to learn throughout the process of using dermoscopy is BCCs can look wildly different.
Yes, they can. Yeah, so. Superficial. You got absolutely. And we're going to do one on BCCs.
Yeah, good.
So, all the things, picking up a BCC and being able to send it down the right pathway. And now I'm at the point now with superficial BCCs. Do you treat them with Epidix and things yet?
So as a non-prescriber, I will generally speak to either the GP to prescribe that. Yeah. But I think I think you generally would trust, as let's say you were prescribing the Epidix, then you'd say, I agree with your decision. Okay. But again, having those photographs on the medical records is so useful, because if I just said, I found a BCC, can you treat it? That's not very good, is it? So having those photos, it means other people can be like, oh, yes, definitely. Again, that is from a physician associate point of view, but I think for anyone, any registrars or foundation years, having the photos on will be useful to whoever they're debriefing with.
Yeah, absolutely. And I think particularly I do quite a bit of cryotherapy. You do a bit of cryotherapy, don't you?
Yes.
And a general rule of thumb is you put photographs in.
Yes.
Because then you can say, this is what I froze, because you don't have histology.
No.
And it's always a good backup to have, isn't it? And then when you can go back and look at it, oh yeah. So I do warts and things. It's lovely to then see the picture of it, compare it to before and after it's gone.
Yes.
Isn't it fun?
Yeah.
Okay. So hopefully that enthusiasm is coming across to people. What do you think?
So.
We're going to give them a thumbs up and say, yeah, enthusiasm's going. Okay. So here's the question then for our listeners. You're about 18 months down the line. You're now confident in SEBKs, BCCs. You can identify the odd melanoma and all those sorts of things. And, you're aware of what you don't know, so your grey areas and how to refer those. How long did it take with that whole worry phase, that whole, to start to feel, actually, I'm getting the hang of this. How long did it take you to get to that point, do you think?
I think it's quite difficult to say because you get to points where you think that you know quite a lot and then something like an ugly duckling will come along and you're not 100% sure. I think seborrheic keratoses can come in all different shapes and sizes. So it is starting to see as many things as possible and getting your knowledge up of all the different things.
So one of my videos, again, look out for this, folks, is one that tells you how you can speed up that learning process by getting to see more patients.
Yeah.
Because I remember there was a phase in my dermoscopic career when I was probably see 4 lesions a week. That's not enough, really.
Yeah.
So, seeing plenty of patients speeds up that whole learning process, doesn't it?
Yes, definitely. Having the joint skin clinic that we were allowed to do really did help me, and I would, if it's able to, ask for skin lesions to be put into your clinic because getting that knowledge does speed it up.
Yeah.
And again, I was alongside you, so if I did have any questions there and then, I could go to you, and then you were able to come and see my patient and show me on the dermoscope, that's what that is, that's what that is. And again, it's that teaching, again, with patients and you just makes it so much easier. So if possible, one of the best things and my tips is if you can, try and get a skin clinic if you possible, or even just ask for all the skin lesions.
Well, in my welcome video, I mentioned about Pando.
Yeah.
And if you're in South Yorkshire, they can join our Pando group, and then you can share images with us and all those things. And the idea of these videos is really to try and give you a hot seat to giving you some of that experience that Isabel had in sitting in that spot clinic and say, hey, look at this, guys, you can do that too. Do you see this here? Do you see that there? And then just carrying on that learning process. And I'm still learning. Which is
everyone
fun.
learns. Like, it's called practice for a reason, constantly practicing.
I must remember that.
It's yours.
I love it. Right, okay, so we've covered your dermoscopes, we've covered Jaffa cakes, we've covered some of the things you've seen and your whole process in. I mean, where do you see the future with dermoscopy? Is it just carrying on with your practice and just refining? Have you got any other thoughts?
I think dermoscopy is now, as I said, a part of my everyday practice. I don't think it's a skill I want to lose, and I hope I don't lose it because it is something that I use every single day in general practice. For me, again, I think I'm a confident and a competent learner, but as you said, you can always carry on learning. So there is the possibility of going forward and doing more things, like getting better at BCC and SCC recognition, but I don't know what that holds. Again, you've got those expensive courses you've mentioned, but you don't necessarily need those expensive courses to get good at dermoscopy.
Correct.
So I think that's something I want to make very clear. You can get very competent at dermoscopy if you are someone that wants to learn and wants to engage. I think that is a thing you have to be enthusiastic about it, because if you find it a bit boring, then it's not going to be for you. But I guarantee that you will get interested in it, because as we've just discussed, this colleague that spoke and said she found some cancers, they are now interested in dermoscopy because they were so amazed by my skills.
It is amazing, isn't it?
Yeah.
Just I think from the patient's point of view, they come in to see you and they expect you to have an answer.
Yes.
And I always think when they come in to see you and say, well, I don't know, their anxiety levels goes up.
Yes.
Because you've got to refer them elsewhere.
If people come to you with a skin lesion, if you do your ideas, concerns and expectations, they are all concerned that it is cancer. And being able to tell someone it isn't cancer is one of the best things.
It is.
And made so much easier with dermoscopy, I think.
It is,
Telling someone that's never going to turn cancerous. Yeah. They're like, wow, that's amazing. Thank you so much. And you really can improve someone's day. Yeah. And like if they want to come back and get other lesions, they trust you.
They do.
And again, you build up that patient-clinician bond.
Absolutely. I had a lady I diagnosed a melanoma on her leg. Looked like a SEB-K, but actually it was a melanoma. Actually quite a deep one. And she brought the whole family, 4 of them. And she was, you know, they were all looking at their moles then, weren't they? You know, Mum's got a melanoma. I found this, I'm worried. So literally had a family session in a 15-minute appointment just to go through the moles. And they were obviously all fine. But then they go away reassured. And that's fantastic.
Yeah, it is really nice being able to reassure, because a lot of medicine, we don't know. When you see someone in GP, the first time you see them, a lot of things you're like, I'm not sure, which is why you go and do further tests. Being able to have this as your further test right there, so useful. It's
so useful. And the other thing, I think sometimes when you first start out, you're worried that I might miss a melanoma, I've got all these things to learn. Actually, when you start with the easy things, capillary hemangiomas, sebaceous hyperplasia, you know, intradermal nevus, get into the SEB-Ks, understanding the range of that. And actually, when you've got all those things, that's probably 75% of what we do, isn't it?
Definitely.
You know what I mean? Because reassure.
Yes.
Yeah, and anything you don't use to refer. Fantastic.
Yeah, it is. I think it has a lot of those things are worrying for people. So having that knowledge and building it up alongside with your dermoscope is such a good skill to have, I think.
Izzy, that's fantastic. Thank you very much. Is there anything else you think you want to say to people that might encourage them, help them in their journey?
I would say if you are at all interested, I would try and pick up a dermoscope if you can, because I guarantee once you start using it, you will infinitely become more fascinated by the world of dermoscopy and how much it can add to your practice. Again, it is one skill out of many that you can have in GP, but for me, it is something that's been so beneficial in the last 18 months, and I know it is beneficial for the GP practice and also all the other people that I work with, because they can go, hey, Izzy, can I ask you some advice? Which is nice to be able to, you know, give some of that wisdom out. If you don't want to do that, that's fine. Like, people like to keep their skills to themselves, that's okay, but I am an avid sharer, I think.
Oversharer?
Maybe a bit. But it's useful, and I am so glad that I started on this journey, because it is a journey. You carry on learning, but I'm so glad that it is now in my life.
Yeah, so keep watching these videos, keep learning. It's a bit like, you know, eating Jaffa cakes, a little bit and often, and you'll pick up those skills and like Izzy, learn to love it. Thanks for watching. Thanks, Izzy.
No worries, bye.
Training a primary care dermoscopist for every general practice.